Joining us now is Dr. Mary Ann Larkin, and we're going to be talking about hearing health care. You know, a lot of times we put off the inevitable. You need to get your hearing checked. A lot of times you might be having problems with your hearing and you just procrastinate. Well, we are here to tell you with Dr. Larkin that today is the day that you can go get your hearing checked and really find out the advances that have been made in wonderful hearing aid instruments. Welcome.
Thank you very much.
Welcome to the show.
I mean, that's really your message. Like, don't put it off. If you feel like if one of your spouses is saying, I can't hear you, or what did you say?
Have I ever said that?
Yeah.
Absolutely. You don't want to wait. You want to act now. And if you think you've got a hearing loss, you want to first seek the professional advice of a board-certified doctor of audiology. And they are able to take a good case history, listen to what kinds of problems you're having in the communication situation, diagnose your problem, and then make appropriate treatment options for you. Discuss them, and then work as a team to try to figure out what can we do to try to help you hear better.
And I love your point that hearing health is really about health care. It's not about a retail purchase.
Absolutely. And I think so many consumers today are just very, very confused. You open the newspaper, and there are full-page ads that say clearance blowout sale for hearing aids and come in for the free hearing test. And you really don't know, they don't know where to go. The seniors don't. And so what we promote at Advanced Hearing Care is hearing loss is a medical condition. It's a health care issue. And it's really become, I think, to the public, a retail issue. And a lot of people will go out and they'll shop for prices and I want to get the best deal. And that's really not where they should be going. Hearing instruments are Class 1 FDA medical devices, and they're that for a reason. And so seeing a doctor of audiology definitely is the best place to start because they're going to be looking at your hearing loss from a healthcare perspective rather than a sales perspective.
Right. And I think that was the key, a doctor of audiology, so someone that has gone to school and been educated properly on the medical condition of hearing loss.
Absolutely.
Right, and really with the technology these days, I mean, we have amazing advancements, really just how small the hearing aids can be. It's, you know, they're not as large as they used to be. Gosh, I seem to remember my grandpa having a big one.
Right. We have made tremendous strides. I've been practicing for 27 years, and when I first started out, they had the big behind the ear and then just the in the ear, but we have got them so discreet now that they're so tiny that you can be wearing them, nobody will notice it at all. I think a lot of people are concerned that if they wear a hearing aid, everybody's going to think they're old, but it's the exact opposite.
Right.
You're in a conversation and you don't hear well. You're going, huh? What? You're furrowing your brow. You're looking old.
Or you're not engaging. Or you're pulling back. And I think that's a big thing. If you realize that you're pulling back, that you're not engaging in things that you normally do, well, you really need to step up to the plate and get your hearing checked and find the solution so that you can live a fuller life.
Absolutely. And so when you wear that hearing instrument, that hearing system, you're appearing more alert. You're engaged, as you said, in the conversation, and you're looking more youthful. You know what's going on. We have so many patients that have been fitted with today's new advanced technology, and they tell us that they scratch their head. Why did I wait? Why did I put off that relief? This is really nice. I'm enjoying being able to hear my grandchildren, my girlfriends at lunch, and it's a really rewarding profession for us because we know that we're really making a difference in the quality of life for them.
Right.
Yeah, it becomes a whole new world that they've been missing, and they just hadn't realized it. In looking, which we're showing on camera, the display of the different types of hearing aids, which there's ones that are behind the ear, and then ones that are molded specifically to fit inside the ear. And what are the differences in those?
Okay. There are various styles, as we've got right on here on the chart. Over on this left side here, we have the behind-the-ear hearing instruments. And we start out with one that's a little bit larger with an ear mold. This is called a conventional ear mold, along with the behind-the-ear hearing aid. Somebody that has maybe a more severe hearing loss, this would be the type of device that you would need. Then we go down to some of the smaller hearing instruments. And they have a very small tip. They're called an open fit type of hearing device. And they're for somebody that has some normal hearing in the low frequencies, but it progresses and there's a deficiency in the mids and the highs. And this is a typical hearing loss of the senior. and they say, well, I don't have that much of a hearing loss. I'm not deaf. I hear, but I don't always understand. You're mumbling. And actually, the family member or friend may not be mumbling.
I'm not mumbling.
So
We'll find out.
it's because they're not picking up all those consonant sounds.
Okay.
They're hearing the vowels, but not the consonant sounds.
Okay.
When we look over here, these are the customized in-the-ear hearing instruments where we would take an impression of a person's ear, and we would send it off to the laboratory, and then it would be molded to fit their exact ear. So this is an in-the-ear. This is called a half shell. This is a canal, and then this is a completely in the canal.
Oh,
And
wow.
So it's really not seen at all, I wouldn't think.
Exactly. Very, very discreet down into the ear canal. But some advancements with technology, we have directional microphones. And what that means is that the front mic, you're focusing in on the speech that you want to hear. The back mic helps to suppress the sounds that you do not want to hear.
Incredible.
So that's one big advancement that we've had with hearing aids.
Right.
They have Bluetooth connectivity. So you can get a hearing instrument and have it stream from your Bluetooth phone. You don't even have to pick up your phone, and the phone conversation
hearing
is
aid.
into your hearing aid.
It's right in your head.
We're able to connect
Some
to
safety things there, especially with driving.
Yeah.
we're able to connect to the television and to the phone also.
That's
So it's
wonderful.
amazing.
That's
Yeah.
wonderful. Well, thank you so much for sharing with us some of the new technologies, especially the difference in seeing a true healthcare professional
Right.
for a condition.
Yes.
We appreciate you joining us
Yeah.
today.
Wonderful.
Thank you so
Thank you.
much.
Great. Be right back after this message.